Joining us now is Valerie Huber, founder and president of the Institute of Women's Health. Valerie, good to be with you today. First off, I want to get your thoughts on the UN including abortion as part of its Pandemic Preparedness Declaration. What does abortion have to do with a pandemic?
Well, what does it have to do with healthcare? What does it have to do with women's health? What does it have to do with the mission of WHO and the pandemic? Absolutely nothing. Abortion's not a right, or is it otherwise an essential component of healthcare, or as they state, essential healthcare? It doesn't belong there.
It seems there's really a push, or at least a focus, on abortion at the UN. But what about improving women's health by providing, better access to prenatal and maternal care around the globe, or putting money into things like pro-life pregnancy centers? I mean, Valerie, are there any efforts on that front?
Well, look, the Declaration has some good things in there, and the UN and WHO do some good things for women's health, but it's almost always occluded by the ideology surrounding abortion. When you go to countries around the world that are in the greatest need, you really hit the nail on the head. Women and girls aren't receiving what is life-saving, what's necessary for them to just survive, let alone thrive. Abortion has no place in this, and we need to reorient our priorities. And really, that's why a coalition of nations came together, because they are tired of this ideology. And so they've united around the Geneva Consensus Declaration. But I think what we saw happen today at the United Nations is disgraceful, and I believe that many countries didn't realize that abortion asserted as a human right was included in what was seemingly a non-controversial declaration.
Yeah, Valerie, and I was going to say that leads to my next question. If a country is part of the UN, when it comes to something like this, I mean, are they bound to it in any way? What can they do if they don't agree with it?
Well, there are more opportunities, but countries need to, first of all, become aware, involved, and very engaged next year at the World Health Assembly. The declaration today is non-binding, but I will say that sounds a lot more safe than it really is, because declarations become the blueprint for policies that emanate from the United Nations agencies that then become funded programs going into countries around the world to press these very ideologies. In addition, some countries, when a resolution or a declaration is adopted at the United Nations, it becomes binding by their national law on those countries that are pro-life and pro-family.
Valerie, what do you think can be done to better promote a culture of life on a global scale rather than death, like what we're seeing right now?
Yeah, we have seen over the last 20 plus years this effort to change what should be promoting health and life into promoting abortion and death, and really taking over the narrative of health for ideology. I think the first thing that needs to happen is that countries, activists, NGOs, academics, healthcare providers need to understand the language that is shrouded, but yet promoting agendas, and not just promoting agendas, but asserting things like abortion as a human right. This becomes soft law that then can become binding on nations, both through international courts and through other instruments and vehicles. So it's a dangerous place to be. So being aware is one thing. And then once aware, countries need to be courageous, bind together, and expose what this agenda is really about, and then bind together to oppose it. I think we saw last year during the UN General Assembly that countries did just that when similar language was introduced in a resolution. And they said, no, not on our watch. We will not support any wrong assertion that abortion is somehow healthcare or that abortion is somehow a human right. That needs to increase.
And Valerie, we're going to leave it right there. Thank you so much for weighing in. We really appreciate it.
Thank you so much.